Welcome to the Business Growth Spotlight, where we shine the light and talk with business leaders from all over the world who are here sharing their expertise and wisdom so we can all grow together. I'm your host, Heidi Schalk, co-founder of HLH Growth Solutions, where we help businesses scale revenue using outside the box AI and visibility strategies. If you're new to the podcast, welcome. We're excited to have you here. We have a new topic today, so I'm really excited to chat with my guest today. I haven't spoken about this topic or this product on this podcast before, so I'm really excited to learn all about it along with all of you. So without further ado, welcome to the show, Matthew Myro Rothman with CannaLnx. So welcome, Matthew, to the podcast.
Thank you, Heidi. It's a pleasure to be here.
I'm excited to chat with you and dive in. So, Matthew, can you tell us about yourself, about CannaLnx, and your role within it?
Yes, of course. So right now I'm based in Cleveland, Ohio, and this is where I grew up. And it was a great place to grow up, very different than it is now, which is better than it was when I was growing up. Let's say that. Fresh off of the burning river when I was a kid. That reputation is gross, and it was welcomed for a chunk of time there. We deserved it, I think. But it's changed a lot. Cleveland's a pretty cool place to be right now. I did my undergrad at Cleveland State University and then moved to San Francisco to pursue a graduate degree in philosophy, cosmology, and consciousness. And that is how I got my introduction to the world of medical cannabis. And so for your viewers that aren't familiar with cannabis medicine so much, in 1996, Prop 215 passed in California, and that was the first ever law in this country that allowed for legal cannabis medicine. And it mostly came out of the AIDS epidemic in the 80s and 90s. And patients were finding incredible relief using cannabis to reduce pain, but also increase their appetite. And they were able to live a more pleasant life at the end of their life. And so this was a major push to actually bring cannabis to the people as a medicine. So I moved to California in 2003. Not that long after these laws passed. And so there was a very, very nascent industry at the time still. And one of the women who was receiving her PhD in the program that I was getting a master's in, she sat me down at lunch one day and said, "Hey, you seem like a pretty cool guy. I have a company that we have a nursery and we root clones and we sell those plant clones to medical cannabis dispensaries. And I've got one other employee and I think that you'd fit in well." And I said, "Okay, great. This is interesting. So you're going to pay me money to grow cannabis?" A 23-year-old who grew up in music culture and enjoyed partaking myself. That was kind of a dream come true. And it became a very quick education into the world. And I spent a number of years with her, helping her grow her company, and ended up managing it as we get about 30 or 40 employees over time. Wow. And then I moved into my own co-op. We had a group of cultivators around Marin County in California, and we got together to grow and produce medicine for patients in the area, and we would sell to the dispensaries. And then I became a consultant and did a bunch of that and just really grew with the industry for about 15 years there. And then adult use laws passed. And so if you're not familiar, there's medical cannabis and then there's adult use cannabis. And I'll get into a little bit more of the distinction between the two. But adult use is essentially for recreational use, if you will. And so once they passed the adult use laws, which people were excited about because, it brings more sovereignty around the individual consciousness, and anybody could access this product now, not just as medicine, but for however they want to use it, which is probably great in general, but not so great for the medical aspects of it. I became a staunch believer in cannabis as medicine. And I saw that the way that the state was going wasn't going to be as effective, and I couldn't be as effective in my strong desire to help people with their illnesses and have cannabis be a major part of that. So I made a jump over to the digital side of things. And that's when I got together with CannaLnx and the parent company EM2P2. And it's a really interesting story, actually. So the leadership of EM2P2 started off as a company called Sequentia, which had a product in the traditional healthcare space where they provided, through use of AI and matching capabilities, when a patient was being released from a hospital and needed to go to a post-acute care facility. At the time, the doctor or the nurse would walk in with a sheet of paper with a printout and say, "Hey, these are your options. Good luck. You got to leave now." And The CEO was actually his mother-in-law went through this and he said, this is disturbing. We have to
Yeah.
be able to figure out a better way to do this. And funny enough, at a wine tasting, the CEO, Gennaro, met my father, Howard, who has been coding and creating software and databases since the early 80s. He's one of the original computer programmers of the world. And so they built that company together. And a few years into that company doing well and being used at the Cleveland Clinic, Gennaro was speaking to some friends in Nevada that owned medical dispensaries. And they had just passed their adult use laws. They're like, oh my God, this is a mess. Patients are standing behind people that just want to get high, and we don't know how to cater to them. And the doctors don't know what's going on. We've got to figure something out here. And Gennaro said, I wonder if we can kind of do what we did for post-acute care facilities for cannabis and kind of rewrite the program to be medical cannabis specific. And spoke to my father Howard. He said, yeah, of course I can do that. I can write anything. But the
Mm.
problem is we don't know anything about medical cannabis. And he says, so I was like, what do we do? And so my dad was like, well, I happen to know somebody very well that is very, very knowledgeable in the space. So I'm not a founder, but I was brought in on day two, essentially. And so that was in 2018.
It's incredible. Your journey has just, been along the entire process of, or all the years. It's been like people just showing up and going, oh, hey, I have this for you. And you're like, oh, which is incredible. So you brought up, Matthew, adult use, recreational cannabis and medical cannabis. So can you share with us the difference between them and also hemp and all in terms of both the legal frameworks and also real world patient outcomes?
Yes. So this is a bit of a complex subject, but it's also really simple.
Mm.
So let me start with the Controlled Substances Act of 1970, where the Nixon administration decided on a classification, categorization of drugs.
Mm.
And they go from Schedule 1 to Schedule 5. Schedule 5 being the most benign drug out there, like a Tylenol or Advil would be in that category. And then Schedule 1 is the total opposite. And these are drugs that can be used for extreme abuse and also have a very, very, very high possibility for addiction. And that's where they put cannabis against the recommendation of hundreds of doctors that went before the Senate and said cannabis does not deserve to be a Schedule 1 drug. It's probably better as a Schedule 2, but more Schedule 3. And that was the recommendation in 1970. And we're finally seeing some movement in that direction. But so cannabis, be it medical or recreational, is still considered a Schedule 1 drug, even though there are over 30,000 different research studies showing the efficacy for medical use of cannabis. It's still considered to have zero medical application whatsoever, which is outrageous. So that's the first place. So as the states started passing these laws, they passed medical laws first, and that became known as sort of a foot in the door so they could pass these adult use laws. And basically what it means is medical is you have to go see a doctor, then the doctor will listen to what is going on with you. And if you have a qualifying condition that the state has recognized, they can recommend that you use cannabis and then can certify that they recommended you to use it. Now, prescriptions cannot be made. A doctor cannot prescribe cannabis because it is illegal for doctors in the United States to prescribe a Schedule 1 drug. So
Mm.
they can actually lose their DEA license if they do this prescription. So that's why it's called a recommendation or a certification. Now, adult use, you don't have to have a doctor's recommendation. You can show up at the store. If your state has an adult use law, you can show up at the cannabis dispensary, make your purchases. Your taxes are going to be much higher. It's going to cost you a lot more. But essentially, it's about the same plant. And so some states have more restrictions and higher regulation around testing in a laboratory to make sure that it's pure, that it has no fungicide, no fungus, no any kind of detritus or pestilence or chemical residue or anything like that. So the lab testing is very, very important. But you have to have it tested, whether it's medical or it's adult use. In order to get onto the shelf at a dispensary, it still has to be tested.
Mm.
So it's essentially the same thing. And then to muddy the waters further, in 2018, the United States passed the Farm Bill. And in that Farm Bill, they snuck in a provision around hemp. And the idea was because hemp is an incredible source for agriculture and for building materials, for clothing, all kinds of different uses. It can be used for hempcrete as a replacement for concrete. They're 3D printing homes out of it. It's incredible. And the United States wanted to be able to utilize this incredible product that had a tremendous history in the early days in the United States, and countries around the world were utilizing hemp in order to reduce the forest chopping down situation that is everywhere. So it was a really, really good idea, and industrial hemp was the way that they wanted to get into it. And so they said at the time that anything that has 0.3% of THC, which is the psychoactive ingredient, one of the psychoactive ingredients in cannabis, anything with 0.3% THC can be considered hemp. Now, that became a big problem because immediately cultivators found a loophole and they said, oh, wow, so I can maybe find other intoxicating chemicals within this plant and breed it to boost those while reducing the tetrahydrocannabinol or THC so they can be under the Farm Bill parameters. And so now the intoxicating hemp industry was born out of that. So there are three federal designations of the same exact plant. So hemp is cannabis. Medical cannabis is cannabis. Adult use or recreational cannabis is cannabis. It's all the same plant. So just in different varying forms of it. So sorry for the long-winded answer, but I
No,
feel like it deserves.
I appreciate it. So are there any states that I thought medical cannabis could be prescribed. Is it
No,
prescribed?
so Schedule 1 drugs cannot be prescribed. And currently cannabis sits as a Schedule 1 substance. But at the end in December, the President Trump, he released an executive order telling the Department of Justice and the DEA to expedite the process of moving cannabis from Schedule 1 to Schedule 3. And I should be specific and say moving medical cannabis from Schedule 1 to Schedule 3, because a recreational drug cannot move out of the Schedule 1 designation, but a medicine can. So
Okay.
very soon it will be able to be prescribed.
Okay. And then what about when it's prescribed, is it going to be able to be covered by traditional health insurance? So, and if not, what would it take for medical cannabis to be bundled into standard health insurance benefit?
Well, I'm very happy you asked about that, Heidi, because that is exactly what CannaLnx is doing right now.
Okay.
And so, in partnership with the American Council of Cannabis Medicine, ACCM, they are the largest advocacy group for medical cannabis, specifically in Washington, D.C. There are lots of advocacy groups for cannabis, lots of lobbying organizations for cannabis, and they're just focused in general. And ACCM is focused on the medical application of this, how we set out to do this 8 years ago, and this is how we are. And CannaLnx is the digital technology backbone of everything that ACCM does. And so we set out initially 8 years ago, and we built this entire ecosystem of for-profit companies and nonprofit. ACCM is a 501c4 nonprofit, which differs from a C3, allows them to do some more political work than other nonprofits are able to do, and advocacy and outreach and things like that. So they worked with third-party administrators that put together bundles with traditional health carriers. So I'm not sure how much you know about health insurance, but this is kind of how the world works, right? You've got the traditional carriers of the world, the Blue Cross Blue Shield, the Aetnas, Cignas. That's your doctor network that you're able to work within, right? But in order to make a policy more attractive to the end user, be it an employer or an individual or family, these TPAs, these third-party administrators, bundle packages to the traditional carrier policies. And so sometimes you'll see a vision bundle or a dental bundle or things like that you're more familiar with. What ACCM was able to do with these TPAs or third-party administrators is create a bundle which they are calling an alternative wellness stipend. And there's over 24 different alternative wellness therapies that are covered by this stipend. And not covered, but reimbursable with this stipend. And it's up to $100 a month reimbursed for things like acupuncture or chiropractic, and even some really unique niche things like Rolfing and Feldenkrais method and float tanks even. So coaching around a ketogenic diet is a really interesting alternative modalities, of which cannabis medicine is one of the modalities that is covered with this reimbursement stipend. So that is the first way in because it's still federally illegal and only legal statewide. The TPAs wanted to figure out a way to make this as low risk as possible on their end, but still be able to find some way to honor cannabis as medicine and be able to help the people that need most to help with the payment of it because it is cost prohibitive for many.
Yeah, absolutely.
But to get to your question, oh, I'm sorry,
Yeah, go ahead.
I didn't quite answer your question. That's what we're doing now. Once the rescheduling happens, yes, traditional insurance will be able to cover. So right now, it's not like a traditional copay, right? So you still go in, you would spend your dollars. If you took on one of these policies, you would spend your dollars and then be reimbursed on the back end. CannaLnx acts as the validation center for purchases for patients to be reimbursed.
Okay. I want to talk a little bit about barriers. So, what are the biggest regulatory, payer-driven, or perception-based hurdles to integrating medical cannabis into the healthcare reimbursement system?
There's a lot of barriers there, actually. And so the biggest one is that cannabis itself is a whole plant. And the more research that's done on the whole plant, the more fascinating it becomes. It's an apothecary unto itself, is what we like to say. So there are certain chemical compounds that make up the cannabis plant that help make it so special. Phytocannabinoids are one compound. Terpenes or terpenoids are another compound. And the cannabinoids are found just in the cannabis plant. Terpenes are found anywhere. That's what gives anything their smell. And so that it's a potent part of any plant compound. And the mixture of these two, there's 130 some odd cannabinoids, anywhere from 3 to 15 different terpenoids that will be present. And the way that they interplay creates this incredible synergy, which is amazing. And it makes this plant usable and showing efficacy for so many different conditions. But it's also a plant. FDA regulations and creating FDA drugs, you can go through years of trials and you have to have one specific acting agent that is that drug. And that's how it works. You can't take anything out of the cannabis plant or else it doesn't work the same. And so currently there are 3 different FDA approved cannabinoid based drugs that are on the market. Epidiolex is one. It's CBD based cannabinoid, which is another molecule that you've probably heard a lot about. But it is antispastic. So it stops seizures, which has been fantastic for children because it's not intoxicating. But then there's also Nabilone, which is a THC based drug, and Marinol, which has been around since the 90s, which is a THC based drug. But they don't have the same effect because what is miraculous about the plant is some people call it the entourage effect. I don't like that because it makes THC the main player. I like to call it the ensemble effect. This truly is an orchestra where every instrument plays its role in order to be able to bring healing. Terrible for trying to get an FDA approved drug out of it because you need this synergy that the plant has. So there's going to be a lot of barriers. We're expecting a up to 5, maybe 7-year moratorium. Not that it's going to stop sales, but to take time to really understand how to use cannabis medicine and maybe even more specifically cannabinoid medicine in order to create formulations out of the plant itself to make it viable and efficacious. But big hurdles in the way. Big
Yeah.
hurdles.
Yeah. I'd like to pivot a little bit and talk about how your business growth and how you all have done it. Because you said you've been in business for 8 years now, correct?
Correct.
Okay. So I'm sure, and you also came from another business that you grew from what, 3 employees to over 30, I think is, if I'm remembering correctly.
Well, that was in the early days. I ended up having my own business. I was
Right.
going
There's a
into
lot of
different
growth.
industries. There's
You've
a lot
done
of
a
different.
lot.
I've done
Yeah.
a lot. Yeah.
You've
I've
done
been
a
a
lot.
serial entrepreneur. I've done a lot.
So I would love to get your like what you've done, especially let's focus on, CannaLnx for now is how are you all getting in front of who are your ICPs? And specifically, if do you have multiple or are you focused on one? And like who are the people you're focused on targeting marketing wise? And how are you getting in front of them? How do people finding out about CannaLnx?
Well, doing podcasts like this is definitely a way for people to find out. And growth was extremely difficult, extremely difficult. And when we got into this in 2018 and we said, no, we're planting our flag for medical cannabis. We're staying on the medical side. We're not going to go to the adult use or recreational side whatsoever. This is who we are. This is what we believe. And everybody looked at us like we had three heads. They're like, you're crazy. The industry was fully going over to recreational at the time. That was where all the investment was going. And so we've bootstrapped essentially the whole thing. We have probably a few dozen, not a few dozen, but a couple dozen investors at this point that came in with lower dollar amounts and kind of chipping away here and there. Like, okay, let's keep the lights on, do this one marketing campaign and see what we can do. All of us, the entire executive team, went years at a time without a paycheck. I ended up bartending and waiting tables nights and weekends and putting my days into this. And so it was extremely difficult. Nobody really believed what we had, but we knew that it was real. We knew that it was necessary for an underlying layer of infrastructure for the industry that connected all the parties that didn't exist. We needed one place where doctors, dispensaries, patients, lab results, and insurance could all communicate completely secure. We're the only HIPAA compliant platform in cannabis that exists because the HIPAA compliance is a pain in the ass. Excuse me, it's an ongoing process. I can't even join public Wi-Fi with my laptop or my cell phone because it's a danger.
Wow.
But PII is critical, right? And making sure that everything is always encrypted was very important. So over the years, so we spent a lot of time doing tons of research and making connections, growing our network, and bringing in doctor groups and meeting with point of sale systems and meeting with lab owners and things like that. It took a tremendous amount of growth, but we finally found our sweet spot right now because of this rescheduling process where cannabis is being recognized as medicine in the Controlled Substances Act, which is fantastic. And so we're like, okay, we held on this long and it's finally paying off that this is the direction the country is going, is with cannabis medicine. So thank goodness. But the way we make money is through transaction fees. Cannabis dispensaries are our customers, and they're our only customers. We wanted to make sure that the platform was always free for physicians, free for patients. We wanted to be the tide that raised all the ships within the industry. And so when patients or individuals or employees are given this new policy with this benefit package with this alternative wellness stipend, they become members of CannaLnx should they choose to use the medical cannabis reimbursement benefit. And when we send new customers to dispensary partners, we get a transaction fee from their purchases there. So it's like, hey, you're making money, so we're going to make money. And the only way that we make money is if we do what we say we're going to do and make you money. So we really set out to have a business model that reduced competition to almost zero and encouraged collaboration. So truly, we do raise all ships.
Yeah, awesome. Have there been any things that you've done visibility or marketing wise that haven't gotten the return that you had hoped for, or just didn't work?
Oh, sure. I hosted my own podcast for 2 years. That was a COVID project and have, I don't know, 50, 60 interviews that I did with professionals all throughout the medical cannabis space. And it was fantastic. And I had some really unique opportunities to make great networking partners. The problem was that it wasn't focused on the business of cannabis. It was focused on the medical efficacy of cannabis.
Mm-hmm.
And our customers are within the business, right? The dispensaries are our customers. So it didn't quite have the reach that I was hoping. And it didn't really provide a customer base for us. It provided me a fantastic education and the listeners even better education.
Right.
But it didn't produce any real dollar results, that's for sure.
Yeah. So if I could give you a magic wand, Matthew, and you can wave it over one challenge or issue you're having right now, and you can go poof and take it away, what would that be and why?
Well, that's a great question, Heidi. There are so many challenges. The magic wand. If your magic wand could become a megaphone that can hit the eardrums of every adult in this country and say, hey, are you tired of what allopathic medicine has given to you? Are you tired of taking a pill that makes you take another pill, that makes you take another pill, that makes you take another pill? If you want to realize the strength of natural medicines and understand the capacity of cannabis medicine and have dollars reimbursed to you through a traditional healthcare policy in order to be able to utilize this medicine, I would love to have that megaphone and let everybody know that this is a real possibility, that this is really out there, and this is really happening for the first time ever in United States history, that there are reimbursement benefits for cannabis medicine.
So what's next for CannaLnx? If over the next 12 months, what are the big goals that y'all have?
Yeah, so we will have our network of dispensaries will cross all 41 states that have medical cannabis programs. That'll
Mm.
definitely happen by the end of the year. Another very, very interesting thing that we're doing. So I'm only speaking to CannaLnx right now, but our parent company, EM2P2, also has a wholly owned subsidiary called FitTech. And FitTech is a really beautiful and fascinating organization. And they work at uh, the social impact level, and specifically with veterans, justice impacted individuals, and indigenous communities, and offer them a whole suite of services. And at the base is the Well Health program that provides similar to something like a Fitbit, if you will, but
Mm.
it gives fitness instruction and challenges and the ability for groups and things like that, all based around a biometric device, watch and or ring. We have both capacity, or we will have both capacity. And each participant, it's about coming back into society and being able to have individuals coming back into society, be it a veteran or justice impacted person, to have the ability to participate fully, to have this fitness and nutrition and mindset and mindfulness and breathing exercises built into a program that not only offers that to build your body and mind strong so you can participate in society, but also offers a whole suite of services for education, employment, housing, and even legal to help with expungement processes. So
Oh,
there are a
wow.
lot of different organizations that focus on one of these things. And FitTech is really the first to create a holistic service suite that has all of these offerings. And so that's starting to grow. The first pilot, it's not actually not even a pilot, it's actually a program, is starting in DC at the end of this month and moving into Maine, Minnesota, North Carolina, several states. So the reason I bring that up is because we're going to merge the two sides of the company, the FitTech and the CannaLnx side, and we're
Okay.
starting a product called CannaHealth.
Ah,
And for the folks out there that are really, really, really into their health and want to understand everything about it. So we're using the wellness platform for well health and the biomonitoring device to be able to monitor cannabis use and have real time bioactivity of what is happening when you utilize cannabis. And so we think it's going to be fascinating to be able to match that data and allow people to have insight into what their use is like. And it doesn't exist right now. And so we're very excited to roll that out probably second quarter this year.
that's awesome. It's coming right around the corner.
It's fast.
That's awesome. So, last question for you, Matthew. Looking ahead 3 to 5 years, what major shifts do you predict in how medical cannabis is treated within healthcare systems?
This is very hard to predict, as I was saying, because of the nature of the plant
Mm.
itself. What The only way that I really see it working is if the FDA continues to honor the plant as a plant, and we're still able to have access to the whole plant to be able to have that synergistic effect that I was speaking to. So it's going to take some time to figure out how that fits into traditional healthcare, but it will. And it'll probably have something about uh, what's it, GMP, right? The good practice. Help me. The Good manufacturing practices. There it
Mm.
is. Yeah. So if you make a product or something, you have to be GMP certified in order to be able to create that product in a plant, right? And so in Europe, there are some markets that have medical cannabis that is legal for the entire country, like Germany, for example. And they make clean rooms where they put the cannabis flower into the clean room and then disinfect it through UV light or some kind of way, seal it up, package it, and then it's able to be sold through pharmacies that way. So I see something similar happening with cannabis. So it probably will keep the dispensary model, but eventually I see that potentially it could be sold at a CVS or a Walgreens.
Wow. Okay. Be much more easy to get.
It would be.
Matthew, can you share with everybody listening how they can connect with you and also learn more about CannaLnx and also the other side of it that you guys are merging together?
Sure. Yeah. So you can find me on LinkedIn. That's the best place. Matthew Myro Rothman. Um, you'll see posts and things like that. But definitely check out CannaLnx, CannaLnx. So links is LNX. And it's not just a platform for validating cannabis purchases. There's over 100 articles that I curate myself every time that there's a new research study that I find out there that's like proving cannabis is useful for some new condition. I always write an article about it and put it up there. All the podcasts I did for a couple of years are on there. So it's a tremendous resource just to educate yourself on cannabis medicine if you choose.
Amazing. So if you're watching Matthew and I on YouTube, thank you. We appreciate you. And if you're listening to us on your favorite podcast platform, thank you as well. We appreciate you. Please share this episode and Matthew with people that you know that you feel would resonate with, would learn from Matthew, and also resonate with his message. So that helps us help them. He's spending time with us today. We want to make sure that we're helping him grow and CannaLnx and EM2P2 grow as much as we can help support him in that. And we need you to help us do that. So the more that you can share, the more that more people will learn about CannaLnx. So you can go to CannaLnx.com. It's CannaLnx. No, yes,
Yeah.
CannaLnx.com. So CannaLnx.com. We'll also have all of Matthew's contact information where you can connect with him, as well as the website inside of the show notes. So if you missed it, don't worry, we got you. If you're listening to us on your favorite podcast platform and you feel inclined, leave us a review. We'd love 5 stars. That helps the platform push this episode out to more people so more people can learn about Matthew and CannaLnx. Same thing on YouTube. If you can hit that subscribe button, we can alert you when more amazing guests like Matthew come onto the show and are sharing their insights, their wisdom, and what's worked for them and what hasn't worked for them in the growth of their businesses. Matthew, before I let you go, is there anything that you'd like to share or say that I didn't get to ask you or we didn't touch on today?
Oh, goodness. I don't think so. I appreciate you having me on and providing the platform for it. It's slowly becoming less stigmatized to speak about medical cannabis in the traditional business sense, which is very exciting for me because it's been taboo for so many years. So thank you for the opportunity.
Absolutely. No, I appreciate your time because as I shared with you before, like behind the scenes, before we hit the record button, I don't know a lot about this space, in cannabis. So, and it has had a stigma around it for so long. And there's a lot of people that don't understand it, but there are a lot of people that need it and really benefit from it. And so the more that we can share about cannabis and about CannaLnx and what y'all are up to and what you're doing, the more that we can, more people can know and support you in your mission and what you're here to do and support people around. So I appreciate you and your time and thank you, especially with this cold weather we're having right now. Yes. You're in, Cleveland. So thank you again for your time. Thank you all for listening and being here with Matthew and I. Go check out CannaLnx.com. And I look forward to seeing you on the next episode of the Business Growth Spotlights.